You see these little things here? These are little pipettes of Celavisc, okay? Celavisc. And it's like fake tears for your eyes to help lubricate your eyes. It isn't just water, have you? It's got some sort of glycerol substance in there as well. Now, if you suffer with fibromyalgia, dry eye syndrome is quite a common trait. Now, people get dry eye syndrome for all sorts of reasons, don't they? You know, whether they're too much screen time. Because if you're like most people, you know, staring at the screen all day, you don't blink, you know. You don't blink as much, so you don't lubricate your eyes. That can give you dry eye syndrome. Plus the wind and what can give you dry eye syndrome. And some people wear what they call water glasses, which effectively they're like goggles. There's lots of things you can do for dry eye syndrome, but when you've got fibromyalgia induced dry eye syndrome, which I have, it's just like constantly sore, my eyes. Let me show you. You see, they just feel really, really sore. It's like I need to constantly lubricate them. That's how it feels, anyway. Hey, white hippies, people, the like button. Now, you see, this stuff really does help to lubricate the eyes. That really does, but it's remembering to use it. Because the thing with this, you see, it's not a treatment to sort out dry eye syndrome after the fact, you know. It's not, you know, because at the end of the day, dry eye syndrome just automatically, like the surface of your eyes are crazed, the damage is done, so it's not going to solve that. But somehow you've got to remember to put this stuff in your eyes as a matter of course before you suffer with dry eye syndrome. But it's usually the symptoms is the thing that reminds you that you need to take your, you know, do your perpetual eye drops. It's needless to say, you forget. And I do it all the time, I really do. And I find that, okay, well, I wear, these are just really specs which I wear. And they do help to, you know, my eyesight. But most of the time my eyesight isn't because the magnification's wrong, it's because of, I feel like there's like they're glazed, my eyes are glazed, that's all. Dry eye syndrome, which they are at the moment. And if I show, you know, I've been working on the old computers and stuff, you know, as you do. And, you know, a bit of drawn board and the other screen up there. I'm just constantly working in front of the screen. So, you know, you could misdiagnose your dry eye syndrome for the fact that you're just using screen time all the time. But I get this problem if I'm using screen time or not. You know, just during the day and what have you, in the workshop and stuff, I'll get, you know, have to use these things to lubricate my eyes. And I find these are the best sorts where you get these little pipettes, you look to break the end off. The problem with like the sprays and stuff is the fluids in there, they can repair a type of hot days, hot days where it can go off. This lasts me a day or maybe two, just a little tiny little drop in each eye occasionally, you know, and you get them in boxes of several, you know, I think there's like 5 of them attached on a strip, and there's 2 in a packet, in a sealed packet. And because I know there's a lot of plastic and it's not great for the environment, no, I agree. But you see, you're putting things in your eyes, they need to be sterile, okay? We don't want them any bacteria growing in like little spray bottles and stuff. No. So it feels like a waste, but you know, what else are you supposed to do really if you want to prevent obviously eye infections, but also deal with your dry eye syndrome. And when you've got so many potential symptoms, if you have fibromyalgia, it's quite a lot to deal with, you know. It really is. It's not easy. No. So you just kind of got to do what you got to do, you know, and otherwise you're kind of like battling everything or without any solutions for everything. Well, you're not going to get solutions for everything anyway, to be honest. That's just hopeful. Yeah. It's not great. But you see, it's like apparently the mucus, I'll get this right in my head now, the mucous membranes in the nose, the mouth and the eyes, they can all dry up. And then you get this dry eye syndrome that causes this, a bit like the Sahara Desert, you know. The salt flats, it was like crazing on the surface, and there is actually coloured drops you can put in your eyes, and you can actually see because it stains the eyes, and you can actually see the actual crazing in your eyes, and it's, especially on the whites of your eyes, but it affects obviously your lenses. Makes it harder to focus because it affects your muscles and stuff, because you've just been irritated all the time in your eyes. It's quite difficult, really. Now, eye drops apparently with vitamin A. I don't think these have got vitamin A in. No, it doesn't say. Maybe I'll look that up, but it doesn't actually say it on there. I've looked at the packet. But yeah, eye drops with vitamin A and can also help keep your eyes moist and sort of help alleviate the discomfort. But it's just one of them things, isn't it? There's just fibromyalgia for you. You just have to deal with the symptoms, but also the not knowing. Because there's always, for me, there's always this element of not knowing. Is it fibromyalgia? Is it not fibromyalgia? And you kind of think to yourself, well, seems like it is, I'm taking duloxetine, that seems to help, which has been used to treat nerve pain, so that would stand to reason. But is it spondylitis or something, Spondylitis? There's another. It's another condition that's very similar to fibromyalgia and often misdiagnosed as such. Now, unfortunately, you're never going to know, are you? You can have as many tests as you probably... And I've had so many tests, but are you really going to know? That's just another thing, isn't it? You've got to deal with in your head, psychologically. But for me, I'm just going to carry on doing what I'm doing and treat what I need to treat just to prevent the discomfort. And I use my eyes a lot, whether it be my woodworking, whether it be my websites, my YouTube channels and that, And I just do what I need to do to try and keep functioning. Because sometimes I do feel, crikey, what the hell am I doing? Just get yourself registered disabled and do nothing, but that's not me. No. And that'll be a hard game as well, because I can walk, I can do this, I can do that, But then other times I can't. And other times I look, I walk like I just got off a horse. It's not simple, is it? It's not simple at all. And trying to convince people there's something wrong with you sometimes is not that easy either. But anyway, I was talking about these things, wasn't I? And I was talking about dry eye syndrome. I got a bit sidetracked. Yeah, I digressed somewhat. Anyway, now, I've got a question for you. If you suffer with fibromyalgia, are you getting dry eye syndrome as well? Because a couple of people I know who do suffer with fibromyalgia, they're not having to take these things. They're not having to lubricate their eyes. They reckon they're okay. Be fair, they don't do as much screen time as I, but although they are on their phones constantly scrolling, mind you, that's not helpful. Anyway, you tell me. Please leave it in the comments down below, but please beat the like button. It helps the channel, Yeah, anyway, it's time for me to go and say toodaloo. Toodaloo.